delighted, friends, to have Dr. N N Prem here with us this evening. Okay. Uh, I'm so tempted to be informal because I've known him for a number of years. But then I think the occasion calls for us to be slightly formal, if I may say so. Okay. So let me do a very quick introduction to Prem. Dr. N N Prem is a leading geriatrician. He's currently the chief consultant in geriatric medicine and elderly care, specialist in the department in geriatric medicine at Jaslok Hospital, Mumbai. He founded the department at Jaslok in 2018. Founded. He's an MD, geriatric medicine from Amrita Institute of Medical Sciences, Kochi, and has done a senior residency at the Department of Geriatric Medicine, All India Institute of Medical Sciences, New Delhi, where he continued as an assistant professor. He has 10 years of experience in the field of elder care. His areas of work include multi-morbidity, geriatric syndromes, dementia. I'm so concerned about it. I went and saw him once about that. Okay. Geriatric oncology, chronic care, end-of-life care. It's such an important thing for us to understand. And community geriatrics. He believes in comprehensive, holistic care for older adults. Once again, welcome, Prem. I'm absolutely and truly grateful for your time. So let us start with the questions, okay?
Thank you. Thanks a lot for having me.
So first thing that I want to understand, I'm very curious about your focus on seniors. How did that happen? What led you to your interest in seniors?
As far as, of course, I would say that if you see, I mean, in general, maybe the fact that I was always sort of maybe respectable to older adults, that was one, but maybe I was always drawn to it. But to be very frank, when I joined into being a geriatrician, I myself did not know much about it. By that, I mean, I had a sensitivity to older adults. Maybe it comes through personal experiences. But more than anything, I think I really sort of warmed up to it, learned more about it. I think I have to really give it to my teachers in Amrita and Kochi, who actually sort of got me into tune. I was lucky that Kerala has always been a population which is older. So, I mean, the more amount of people who were there were older adults. So that experience, that training, I think, ultimately you have that sort of, I always knew I was good to older adults, but then you need to be put, you can say, to good that adequate training and sort of sensitization to the particular subject of how you can help them. Because it's not that general notion that you only sort of, I mean, geriatrics is not about just talking and getting a way around older people. No, it's not. It's about actually identifying the problems.
Yeah.
And at the same time, addressing each one of them, because the problems are not always medical. So it's kind of, that's why I said I believe in something as a holistic sort of care. And more than anything, as I'm now here, I mean, I can retrospectively answer your question, is that it's basically I've only added to my experiences, because every older adult I see is actually a 60, 70, 80-year life experience. So I actually sort of maybe learn more and more from them. I a lot of times use my knowledge to actually superimpose to what their life experiences are. But at the same time, yes, we should not forget that health is very important. So, I mean, health is where I come in. And I think physical, mental, both, because I mean, the pandemic has made all us realize that the mental aspect of health was always as important. It's just that we didn't talk much about it because of unfortunate taboos, which were always there.
Yeah. In fact, that leads me to the next question very naturally. So what are the specific issues that seniors face in India today? I mean, let's talk about both pandemic, pre-pandemic anyway.
Yeah, absolutely.
What are the key issues that seniors face?
I think you can say it's, as far as older adults are concerned, it's always this life course. So basically there are stages of life. We know that it's youth, then we know that, I mean, young youth, then middle age, and then we go on to older adults. So somehow, I mean, till 59 and 364 days, 59 and 364 days, we are all ready for retirement. I mean, 60 is just the age which has been sort of put upon us purely because it was a retirement age which was put earlier, but it's not necessarily. Abroad it's 65, and usually we have divided into certain things like young old, middle old, and old. So it's 60 to 69, 70 to 79, and 80 to 80. So as we go through, we should understand that there is an aging which is happening, and we have been aging since day one.
Yeah.
So we are bound to have certain issues which might be age related. Now we have to differentiate that from disease. For example, dementia. I think dementia is one of the very important things which is quite common pre and post pandemic both. In fact, the burden is only going to increase because a lot of people couldn't go out, so the mental sort of aspect obviously was affected. Then I think the metabolic diseases which have already been always a problem. I think the cardiovascular diseases like coronary artery disease, then even diabetes, then hypertension. I think depression is common but not talked about. You are not able to sort of, we just brand it in general that yes, maybe there's a bit of negativity because we are getting older. That's not the case. Depression is actually a diagnosis. It needs to be addressed, and most importantly, it's treatable. False. I think the fact that you are independent and everything is okay. I mean, we have had so many patients in which the life course is so perfect, but one fall and everything changes.
Correct.
So falls are something which are always put into our mind that you should not treat them. You should prevent them, because treatment can be very sort of difficult. Then I think bone health, very neglected. Osteoporosis is very common. Unfortunately, always discovered maybe after an admission, after somebody has fallen. The bones are sort of broken, and then you realize, oh my God, they were so weak. And unfortunately, it's a bit of the work ethics as well. For example, if you're in a cabin for a long time, you've not been having any exposure, but at the same time, you've not taken care of your health as such. Then there is obviously very commonly, I think infections are common, like pneumonia and even urinary tract infections. So, urinary problems per se, like increased frequency of urination. A lot of people can lose control on their own urine. So that is known as urinary incontinence, which is common both males as well as females. Of course, in males, it's more of the prostate issues, which are usually sort of as you go older. Then, if you see the age dynamic, then yes, as we are getting older, the amount of cancers are also increasing. The propensity has been seen that even cancers are very, very sort of common. But these specific things I mentioned, including dementia, depression, falls, urinary incontinence, then there is an entity known as frailty. For example, a frail older adult, if gets admitted, might actually not come back to the original level after admission and discharge as compared to a normal older adult who will be just maybe affected for that particular time, but after some time might come back to sort of normal health.
So our issues for issues for seniors in big cities very different from for seniors in smaller cities? Is there a
I think a very pertinent question. So I was actually sort of going to get into that only. What has been seen is, I think sometimes it's also known as a lack of diagnosis. Maybe it's not been diagnosed in the rural areas, but in the senior, in the urban space, a lot of things. I mean, accidents are actually one of the most common causes of death, which is something which we never sort of realized throughout as well. But apart from that, diabetes is huge. Then even to an extent, metabolic diseases like cardiovascular diseases, then stroke, then even dementia is really getting increased. If you see the rural space, I think somehow maybe the lack of, I won't say lack of stress. There is stress always for everybody in every setting, but I think the amount, maybe there is already that physical activity which has been done. For example, if you quote a farmer who's a 70-year-old farmer who's still active, maybe more on in an organizational way rather than doing the hard yards which he or she used to do earlier, might have a lesser chance of being sedentary and having a metabolic disease like a cardiovascular disease. So I think the problems happen if something happens, then the healthcare is not available. So it's more of if something goes wrong. I mean, even rural population, there is a huge amount of, cardiovascular diseases as well. It's not that it's not, but sometimes it's not diagnosed. So by the time it's get diagnosed and they actually sort of look at further care, it might be sometimes late. So it's more worry if something wrong happens, then who. as far as the structure of the family is concerned, I think just paused a bit. The structure of the family is concerned, I think they still can bank on to an extent the fact that there might be an extended family which might be taking care of the fields, or maybe a second generation, third generation. So their sort of social strata is there. Whereas because of urbanization, sometimes maybe people are in different cities. So that support system might not always be there, and it might be replaced by maybe a paid support system, which is also which is also very sort of common, and I think that should be there. So overall diseases are sort of not very different, but access to healthcare is only got better. In fact, after pandemic, the telemedicine has helped us get us more closer to the rural areas also.
Okay. So tell me, the other thing is there longevity increasing? With that, there are more issues cropping up. I mean, for instance, there used to be a time that if you are 60 and then you cross 60, that was big. But the number of guys who are touching 80 and 90 these days are quite high, I see. I mean, from my own relatives, many of them are, and when all my classmates today are in the age group of 70 to 73, right? And most of us are quite fit. So is this increasing different issues? Is there an issue coming up because of the longevity?
Yeah, I think in general, world over, yes, longevity is increasing. Even in India, as such, longevity is increasing. I mean, we might always call us maybe a young nation as such, but it's not that way anymore. There is a long, I mean, the health has only improved. So what is happening is, earlier it was, as you said, it was considered to be an effort to live to a certain amount of, so we didn't know what happens after that. But then what, the organ is 80 years older now, 90 years older. So the chances of getting risks are even more. Now, for example, earlier, if I have to give an example of HIV, HIV was supposed to be the death knell. If you get that, and you will not go up to a certain amount of age. But now what is happening is, with better medications, people are living with HIV and getting older. So as they grow older, things like frailty, things like constipation, things like side effects of the medications with an aging body, which was not there earlier, because we were only thinking about till this particular age only, anyways people are living. So what is there to think about the side effects of medications later? So that is causing more of a problem. So the interaction between an aging body, the disease, and the drug is sort of causing more problems as compared to the disease only. So I think that is one of the major differences, and that is what we will face as healthcare professionals. There, in an aging body, people will live longer, but we will have more challenges in sort of actually taking care of them, because everything presents differently as compared to maybe a younger population.
So as an Indian society, or even as a country, are we sensitive to the elders' issues, or are we actually becoming more and more insensitive to these issues because we are chasing things? We want to compete with other nations. I want to make sure that my incomes are going up and people's education standard of living was going up. I mean, banana hai, banana hai, everything is there, right? So how are we as a nation coping with this change?
No, I think we are. I mean, the biggest, I wouldn't say one of the biggest examples is, I mean, even although he might deny it, but even the person who's at the helm of India himself is actually above 65, but he still is very active. So I think he's sort of an epitome of the fact. Even if you remember APJ Abdul Kalam, sir, he was actually very active during after 65, 60, 75, whatever age he. And I mean, ironically, he died while teaching, so on stage. So that is what he wanted to do.
Right.
So I won't say that we are insensitive. I think it was more of a lack of maybe understanding what's happening.
Okay.
It's not. I don't think all older adults need care from younger people. It is to understand which older adults need. If an older adult is independent, I want all empowerment to them. They should be able to take it, because they have an autonomy. So they will be obviously taking care of their particular decisions, whether it is even an end of life or whether it is about their disease. But the fact that who needs that extra help, that is the identification that needs maybe more sensitization. So I mean, most importantly, I think to answer it, the older adults are a heterogeneous population.
Okay.
So you cannot just generalize them saying that all older adults, for example, there are myths of aging, will have memory problems, all older adults will be depressed, learning is absolutely impossible after a certain age. I don't think so. These are all myths which have been just created. So we need to identify which older adult needs help, and that is how that sensitivity will sort of increase. So they have to understand there is a fit older adult also,
Correct.
but there is a life course.
Right.
That unfitness, I mean, that unfit part can happen, and that is where health is sort of a common thing in which health has to be,
I understand.
because you can be dependent or you can be independent depending upon how healthy you are.
So you can't paint everybody with the same brush. That's what
Yeah,
you're
you
saying.
can't. You can't.
Every person, every elder is different. His or her issues are different. And the needs that they have in terms of support and care are different.
Yeah.
And the level of independence could also be different.
Absolutely. Absolutely.
Amazing. So which country in the world leads in care for seniors? What can we learn from them? Is it US or any of the European countries? Is it Japan, for instance? What can we learn from them?
I think there are multiple countries who are actually quite aging. I mean, Japan is has got one of the islands in which there are people, a large number of people who are above 100, who are above 90. But it's a generational thing. It's not that there is only one generation. So they have been doing something right. It has been diet, it has been their amount of physical activity that they have been doing. And more than anything, so since they have reached that centenarian sort of thing, so we have been able to analyze what they have done. So for example, if you don't have that population only, then how do you sort of analyze? Unfortunately, in most trials, older adults are left out. So then how do you get to know? It's not the case now. Now we obviously more and more older adults are involved. Then of course, as far as care is concerned, I think even China to a great extent had a lot of an aging population. Then United States of America and in general Europe, UK and US were always at the sort of helm in the fact that, for example, if you tell me that where we are now, maybe the US was maybe at around 20 to 30 years ago. So we are still doing a bit of sort of catching up as far as level of care is concerned. But everything, I mean, even Australia to a great extent and New Zealand. But I would say all of them have different challenges. Our biggest challenge is our population. And our population with all segments, the older adult population is also sort of increased a lot. It's not earlier, it was like infant mortality rate high, so young population not there. Middle population going on, but they are not living up to old. So it was only about taking care of the middle population or maybe the young. But now it's not the case. We need to be more and more sort of ready for, I think, the older adult population. So if you have to learn, I think it's the level of cares. That, as I said earlier, every older adult is different. So somebody, you might have to take care of them in the hospital. Sometime you might have to take care of them at home, or even assisted living, or even elder care communities. I mean, this myth that elder care communities is something where older adults go to, where their children actually say you go. No, that's absolutely not. If older adults are independent, they are deciding that I don't want to be at home, my home. I want to be in an elder care community where we have severe set of people and I can continue to enjoy with them because there are activities in those communities. So all those things have come. So, but I would say every country has its model. So for example, if you have to make something for India, it has to be quite different as compared to what is happening in the US or the UK or even Australia.
So you can't just sort of pluck something from here and implant it here.
Absolutely not. I mean, it has to be modified and customized. I think customize is the word. Absolutely.
Right. So the other thing that I want to ask you is that I learned that you're associated with institutions like Dignity Foundation and other organizations in serving seniors. Is that right?
Yeah, I have sort of done a bit of work with Dignity in the sense that I have done some webinars, of course, and Sheila Srinivasan ma'am has been doing quite a bit of good work as far as the Chai Masti centers and all, which is good throughout. Yeah, I have sort of through my formative years, even in in Amrita, as you know, I mean, Amma is doing a lot of good work anyway. So we were sort of in a way associated with that as well, wherein we used to see a lot of people who used to visit Valdikau, which is one of the centers where she used to be there. Then apart from that, yes, HelpAge has been a sort of an association since my days in AIIMS, purely because HelpAge is one of the organizations. HelpAge International is there. HelpAge India has really sort of been a forefront, especially in trying to help out people. I mean, even recognizing elder abuse to a great extent. They actually have an yearly report of elder abuse, which they sort of put up. It's a survey which they put up. And so that is there. And of course, there is, I mean, I'm a part of an initiative which is known as Graceful Living. So that is, there's an NGO which is known as Tulsi Trust. So through that, I mean, I was instrumental in sort of starting the first support group for older adults, which we started in Jaslo. And that we have sort of continued now in online. obviously we had to sort of adapt. And I mean, I wouldn't say I'm surprised. I mean, learning has no age. So all older adults picked up technology and they sort of came. But my only question here was, through all these NGOs, through all these things, associations, what is most important is we need to make sure that care reaches out. I think that is the way things have to be done, because older adults, not everybody can come to you. I mean, that's the way it works. So whether it's through telemedicine, whether it's through, I mean, I think technology training was something like HelpAge itself took a lot of sort of initiative on that self for digital literacy. So that helped a lot of older adults to bridge boundaries. So I think that is also something which I was also part as far as graceful living was concerned. And then, of course, I mean, one of the very important things which I sort of realized was there are a lot of unsung heroes in older adults. And they need, so through graceful living, we actually try to give platforms to them. I think there's something on a successful aging. Like there is a 76-year-old who is actually did a diploma in gerontology, which is a degree, at 76. So, I mean, there is no particular, I mean, that was done through Tata Institute of TIS only. So, I mean, that's what, so I think try to highlight people who are trying to make a difference. I think that is also sort of, that's what you will have to do. And through various organizations, what help can reach out. I think that is the motto which I look at it, because you have to help the elderly. If people have similar thought processes, it obviously helps.